Chapter 7. Gawande discussed Monopoly's case with several doctors from Uganda and South Africa. They told him that without access to so many treatments, or funds to pay for them, Monopoly would have been allowed to die at home. They conceded, however, that as their country's economies grew, they were facing more end-of-life issues and were aware of hospice programs spreading worldwide. In underdeveloped areas, people die at home because medicine has nothing to offer. As countries develop, people have more money to spend in an attempt to avert death with medical treatments. By 2030, it is expected that half to two-thirds of the world's population will be middle class or higher, which means more people will seek out ways to delay aging and death. However, as the awareness develops that over-treating patients can be harmful and wasteful, hospice programs will become more attractive. In 2010, 45% of deaths in the United States were in a hospice setting. The times are changing, but the idea of a normal death is still evolving. Gawande experienced this firsthand as his father began to decline, and a rare type of tumor was discovered growing in his spinal cord in 2006. One surgeon wanted to operate immediately. Another surgeon said such tumors often grew slowly, so there was time to wait before operating, as long as Gawande's father was satisfied with his quality of life. Neither surgery promised anything but palliative relief. The second surgeon, Edward Benzel, at the Cleveland Clinic, took a lot of time to explain the situation and determined that what Gawande's father really wanted was to go back to his regular life for as long as he could without surgery. Benzel was a doctor taught to be interpretive, a method that helps patients explore both their options and their own needs. This was a new combination of the traditional paternalistic doctor, who tells patients exactly what to do, and the informative doctor, who gives out information without opinions. Most patients want doctors like Benzel. Gawande had always been an informative doctor until he realized that the style was not sufficient for him anymore. An experience with another dying patient who went through one treatment after another was the final catalyst that made Gawande realize how quality time at the end of life could be a gift. That was what Benzel had given his father. Atmaram Gawande made an extra trip to India and talked extensively with his children. In 2009, Gawande's father was developing paralysis. Using his new understanding, Gawande was able to determine his father's wishes. This became important when his father suffered heart trouble on the operating table. Gawande knew that his father would want to risk heart failure rather than live paralyzed. The operation continued. Doctors, including Gawande, pushed for follow-up radiation treatments. These were debilitating and accomplished nothing. Chemotherapy was recommended, but the oncologist offered only a long and overly optimistic list of drug choices without discussing the option of doing nothing. Again, using his new understanding, Gawande pressed for a realistic assessment of what the chemotherapy would achieve and how it would affect his father. The paralysis progressed quickly as Gawande's father considered his choices and finally chose hospice without chemotherapy. A hospice nurse supervised his care and made sure he had everything he wanted and managed his pain. Every day was made as good as possible for him. His strength improved. With a little help, Gawande's father was able to walk into a graduation ceremony at Ohio State, where the author was the commencement speaker. This was what hospice was about, and what having the hard conversations could result in. Key takeaways. Gawande saw the good effects of hospice firsthand as his father battled a spinal tumor. Traditional doctors tend to be paternal, giving orders. Modern doctors tend to either be informative, simply relaying information, or interpretive, finding out patients' wishes and helping them make choices. Gawande realized from his father's doctor that he had been an informative doctor, but he now wanted to be an interpretive doctor.